Family matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Thanks for watching Afternoon Live. Oregon is facing a rapidly aging population, and with a shortage of primary care providers, this brings a unique set of challenges and opportunities. Here to share how Providence is making a difference in caring for older adults, we welcome nurse practitioner and medical director of Providence Senior Health, Dr. Colleen Casey, as well as graduate of the Geriatric Mini Fellowship Program, Dr. Sarah Rahkola. Thank you both for being here.
Thank you.
Lots to talk about today. So Dr. Casey, tell me just the basics of what this fellowship is and why it's so important right now.
Yeah, thank you, Hannah. Our senior health team developed the Geriatric Mini Fellowship in response to Providence leadership coming to us and saying, we have a lot of older patients, we have a lot of providers who haven't had specialty training in geriatrics, and we need your help. So we created a 4-week Geriatric Mini Fellowship where we bring in 6 to 7 providers each year. We've graduated 30 doctors, nurse practitioners, and physician assistants. And so we use active learning techniques to really train them up in what we call the 4 M's of age-friendly care. That's a national model, age-friendly is. And the 4 M's are mentation, mobility, what matters, and medication. So high-risk medications, mobility is often around fall risk and preventing injuries from that. And then mentation is how to best care for older adults who have depression, anxiety, and cognitive issues like dementia. And then we work with our palliative care team members to deliver what matters, and that's so that older patients, we can help them get what they need and what they deserve.
Yeah, absolutely. So Dr. Rahkola, as a graduate of this mini fellowship, what's it meant to you in your day-to-day practice as you move forward and help these older patients?
My primary care practice in Newburgh spans ages 18 to 107, but is very heavily geriatric. And I realized early on that the training for internal medicine doesn't always acknowledge the inherent differences in the older adult population as compared to adults in general. So I jumped at the chance to do extra training in geriatrics from some of the experts in our system.
Sometimes you hear the word geriatric and it just makes you cringe because you don't want to acknowledge just aging on its own. But do we kind of have to just put that stigma aside and say it's just a specific sort of part of medicine?
Well, the study of older adults is what constitutes geriatrics, and what we recognize and what we teach our learners is concepts around ageism and how to recognize ageism, how to recognize our own tendencies to perhaps diminish older adults. So our graduates really leave. We've had 30 graduates so far across about as many clinics, and then they bring in team members each week, nurses, pharmacists, physical therapists, and care managers to help learn with them. So then they go out to their clinics to become geriatric champions.
That's wonderful, because sometimes we hear a lot about advocating for yourself in lots of different forms, but with these older adults in medical setting, do they need some extra training sometimes to raise their hand and say, well, actually, I'd like to talk about this, or I have some more questions?
They absolutely do. So I think both empowering the interdisciplinary team in the clinic space so that everybody is knowing how to care for them, but also letting the patients know it's important that I, as your doctor, know what's troubling you, and that being honest with me, not being ashamed of things, but bringing things up, talking about them openly, often bringing a list with you to your visit can be really helpful, so we can touch on those things.
And what about, I guess, the next generation, maybe Gen Xers caring for their parents, or people kind of preparing for that stage of life? Are there things that they should prepare for or look out for to prepare their parents as they might become the caregivers to that generation as well?
Yeah. Looking forward is always really important, and I think there's a lot of misassumptions about even what normal aging looks like. And so I think it's incumbent upon daughters and sons of people who are aging to, even if they might not need to be involved in daily aspects of life, to have an awareness of what they might expect how they can accompany and be of help to their parents, whether it's with a move or hard conversations, and just destigmatize some of the conversations that can be really difficult to have.
Yeah. Thank you both so much for being here. It was great chatting with you.
Thank you for your time.
Appreciate your time, of course, and we'll have more information on our website at KATU.com. We'll be right back with more Afternoon Live right after this. First, let's check in with Helen.